Hello and welcome to Your Health Reclaimed with DrPND, where we help you reclaim your health with tips, tools, and resources to live your most optimal and vibrant life. Here's your host, DrPND.
Hello and welcome to Your Health Reclaimed. This is DrPND, your host, and today we have a very exciting guest. His name is Dr. Daniel Q. He is a friend of mine and a great chiropractor in the Marietta area. Him and his wife, Leanne, have two practices, which I'll let him talk about. But he is here today to discuss the health benefits of chiropractic. He's going to educate us why chiropractic is an essential and very important part of a healthy lifestyle approach. I personally have used chiropractic since 1997 continuously, and I can vouch for the many, many great benefits that has brought into my life. My wife, when her and I were joined in 2006, as well, has been a big proponent and a user of the service of chiropractic care continuously. Dr. Dan has served us for quite some time, and since we moved to Georgia a while back, and today we're going to interview him again to get a great understanding of what chiropractic is and why it should be an important part of your healthy lifestyle approach. So, Dr. Dan, welcome. How are you doing, sir?
Good. Thank you so much for having me. I really appreciate it.
Pleasure.
Yeah, this is awesome. I really appreciate it. Thanks for the kind words, and yeah, I'm just excited to share. So whatever it is that you guys want me to explain, I'm happy to do it.
Thank you. Thank you so much. Thank you so much. Well, let's tell us a little bit about yourself. Where
Sure.
did you go to school? What is your practice exactly? I know you guys have two offices, one in Alpharetta, one in Marietta. Just tell us a little bit.
Sure. So I went to school. I'm originally from Buffalo, New York. So I'm a northerner, and came down to Life University in Marietta in 2004 to pursue my career, my education in chiropractic at Life University, which is one of the largest, chiropractic universities in the world. Yeah. Feel like most people around this area are familiar with it. So,
Oh yeah.
yeah. So came down in 2004 to do that. And, my journey into chiropractic is maybe a little different than a lot of people maybe would think. I actually started going to chiropractors whenever I was very young, around the age of 6 or 7 years old.
Oh, that's
Yeah.
amazing.
So, my parents were actually both registered nurses, and they met a chiropractor, and they started going to see him for whatever health concerns that they had, and they started talking to this chiropractor about some of the issues that I was having as a kid, and this will kind of go into some of the things that we can help with, as this conversation progresses. But as a young child, I was a pretty sick kid, right from the get-go. So really bad things like allergies and asthma and ear infections. Had multiple surgeries on my ears for ear tubes.
Wow.
Really bad digestive issues. Was allergic to basically every food that there was, and just a real struggle to thrive as a young kid. And so my parents, like I said, were going to this chiropractor, and he was a family chiropractor, which is the same way that we practice now. And he just basically said, "Hey, let me explain chiropractic to you, and I think that your son could benefit from this." And so they brought me in, and I started seeing a chiropractor around the age of 6 or 7, and very, very quickly, my health improved. All of those issues that I just mentioned essentially started to dissipate, and my body started to get stronger, and it started to heal up. And as a result of that, I was able to live a very healthy, normal childhood and life, and engage in all the things that normal kids do, things like sports and and outdoor activities and all those things that I honestly was struggling a lot with up to that point. So as a family, we went to chiropractors for many, many years, like all the way up probably to my early teens. We were very consistent with it. And then, like some things, it just kind of falls off, and we were busy with life and all that stuff. And then around the age of 18, I actually got into a car accident. and pretty bad car accident, head-on collision. And I came home that day, and my mom said to me, she said, "Hey, you should go and talk to Dr. Bova." That was our chiropractor back in Buffalo. And I said, that's a good idea. And so I went down to see him in the clinic, to explain to him what happened, and that kind of got me back into getting checked and getting adjusted on a regular basis. And so one of the things that actually got me into chiropractic obviously was the backstory of how it greatly affected my life. But honestly, at that time, I was just kind of like at a crossroads in life, and I just remember walking into his office, and there was just all these happy kids and happy families and people getting help, and just people really like approaching life in a very positive way. And I just remember sitting there thinking, you know, if I could have a career, because at that time I was doing construction, nothing wrong with construction. I love it. I still do a lot of it myself. But I was like, if I could have a career where I could help people and I could see people and I could interact with them the way that, this guy is, I would love to do that. And so I started talking to him about it, and so he suggested that I come down to Life University, check out the campus, and I did. They were having an open house back in 2004 September, and I literally signed up that week, and I was like, "This is what I want to do." I'm in love with it, and honestly, like kind of the rest is history. The educational process is very grueling, but that was kind of my start into chiropractic. And fast forward here, we've been in practice now for about 16 years in the Marietta, Alpharetta area. So very blessed to have this as my career path, to say the least. So.
That's amazing, man. That's amazing. So two things you said. One of them is that it has been a big pattern. So your testimony, I have seen and heard many times. Again, like just issues and that really have been helped greatly by chiropractic. And it's very true. Again, I used to do functional capacity testing when I was in college for a company called Isomite Diagnostics. So we had 48 accounts and chiropractors, they're all chiropractors in the state of Florida, from all the way south all the way to North Florida. And I've seen those patterns, and because I used to work with those guys, and I've seen those testimonies time and time again. People getting off medications, just feeling better, doing better. And the other thing that you mentioned is when you went to your doctor's office, you saw positivity and people were happy and excited. Like the expectation is, okay, you go to a regular doctor's office, everybody's kind of mundane, people just a little bit, like, I don't want to be here. But like when you go to a chiropractor's office, like kind of like going to your favorite uncle's house.
Yeah.
Like it's always positive, there's no pain, there's no suffering, it's just positive. You have positive energy, and also ultimately, of course, the positive aspect and the help of chiropractic. But yeah, these are two things that stood out to me. Like I said, this continuous pattern of those positive feedbacks and testimonies of healing, and massive symptom relief, if anything, and also this positivity of this family, friends, unity that when you go to a chiropractor's office, so that's so true. And you get close with your patients, tell me if I'm wrong, but you get to know them on a personal level. It's not like 15 minutes in and out, 15 seconds or whatever, impersonable aspect, but it's very personable. You get to know the stories, you get to know the families. So yeah, that really stood out to me when you talked about that. So let me ask you this. What is the education process like? Because you are a doctor. It's a grueling program. I've seen the curriculum.
Yeah.
And the misconceptions out there that it's not it's thorough. It's not. It really is kind of easy. That is not, has one, obviously, all the people that I've known, all the chiropractors over the years I've known, that's definitely not been the case. And two, I've seen the curriculums myself.
Yeah.
So give me your feedback on that.
Yeah, I mean, it's definitely a long haul, to say the least. Just like most other doctorate programs, you have to go into it with all of your undergrad done. So, or at least the prereqs, just like for medical doctor or whatever else you might want to pursue. So, I had my undergrad in a bachelor's in biology. And then the actual chiropractic program itself, the one in Marietta, all the schools do them a little differently. Some do quarter
Sure.
systems and some do semester systems, but the one at Life is, basically 3.5 to 4 years if you do it all year round with no breaks. So it's a huge undertaking, and you have to learn all of the things that you might expect a doctor to learn. So we did the biochemistry and the gross dissection. Spent a year dissecting bodies, and throughout that process, we had to take, multiple national boards. Like once you complete a certain amount of your curriculum, you have to actually go and sit for a national board, for licensure and all of these different things. So yeah, it's a pretty insane 3 to 4 years, depending on how quickly you want to do it. But it gives you a very rounded understanding of, number one, the human body, like how it actually works. Okay. One of the beautiful things about the chiropractic education, and in my opinion, from what I've seen, with like my medical counterparts and friends of mine that are medical doctors, things like that, is the chiropractic curriculum spends a lot of time trying to help you to understand the physiology of the human body and how it actually works and heals and functions. Now, we do take things like, we had to take pharmacology and we had to take toxicology and all those things, even though we can't prescribe and we wouldn't want to prescribe medications, but you have to understand how all that stuff interacts with the body. But we spent a lot of time trying to understand how the body actually works and how it functions, and then also obviously how that plays into the art and the science of chiropractic and what we're going to be doing with our patients. So
Yeah.
definitely a big undertaking, and you definitely come out of there with a whole different perspective on what the human body is and what it's capable of. But well worth it, obviously, in the end.
Sure.
So yeah.
Wow, this is amazing. Yeah, I had a couple of colleagues that one of them was a medical doctor. He was an MD practicing. He actually went to chiropractic school. So
Oh,
he
nice.
yeah, and he got humbled. I mean,
Hmm.
pretty good. He got humbled. Obviously, medical school is no joke. Any good
Yeah.
medical school. But that's exactly the same. He goes, the pharmacology was easy because obviously they spent a tremendous amount of time on
Yeah.
pharmacology. But he
Tremendous
goes,
amount. Yeah.
man, physiology and dissections and stuff like that. He goes, I thought I was going to be good. He goes, I wasn't.
Yeah.
Yeah, he got humbled pretty well.
Yeah.
But so
And I think it's just, honestly, it's just, in a lot of ways, it's just different focuses, and there's a time and a place for everything,
sure,
to be quite honest. But that's just the experience that I had was, just how much it helped you to understand, honestly, the beauty of the human body, and how the whole thing works and how it functions and how it develops, and then how we can have a positive impact on that through the things that we do in our life, or obviously a negative impact on it,
of course, yeah,
depending on which way
sure,
you want to go. So,
yeah.
but yeah, it was an awesome experience. I'm glad it's over. I don't know if I could get through it again.
No, I see the firsthand with people. It's brutal, man. It's
Yeah,
no joke. Yeah.
yeah. So,
Oh, that's amazing. Yeah, one thing you said is something that I always try to drill. People like fads, they like clicks, they like kind of this singular, polar opposite. That it's either conventional or it's either holistic or it's either that. And I always try to get the message across. God gave everybody a gift for something.
yeah, for sure.
We all have things to contribute. And what I would like to see healthcare come, in the United States is that everybody works together.
Yeah.
And on a very low level, personal level, I've seen it. Like one of the, I knew an orthopedic surgeon. His name was Dr. Nucci, a prominent spinal orthopedic surgeon at a research institute that still does in Tampa. A brilliant guy, phenomenal. I think he's third generation spinal surgeon.
Hmm.
One of his biggest referrals was three of the chiropractors in the Tampa Bay area. I
Yeah.
was a patient of his due to really bad car accident, and I had 3 herniations. I had a bulge. I asked him, like, would you recommend surgery? He goes, absolutely not. He goes, let me refer to a good chiropractor, and he literally had the name, the cards, and everything in the offices.
Oh yeah.
And very much, and I've seen this pattern with other spinal surgeons that would very heavily because they understand.
Yeah.
And that's a perfect example how everybody works holistically together for the betterment of the patient,
Yeah, for
as
sure.
opposed to everybody betting on everybody else and this and that. A lot of my seminars, when I do, people they'll start to unload on conventional medicine,
Hmm.
and I'll have to stop them right there. I said, you're wrong. You need conventional medicine on many levels. Many people do. It
Yeah.
can be literally life saving. And not to mention, from a practical standpoint, very few people, relatively speaking, are really willing to completely change their lifestyle.
Yeah,
From a
for sure.
nutritional standpoint, from lifestyle choices and habits, very few people are truly, so you need that.
Yeah.
I'd rather you take insulin and metformin for the rest of your life, whatever that might be, than you not. And
Right.
so that's a very good message, like you said. It's that's what honestly I would like to really see medicine come together. There's no blockage, the red tapes are done, and people are well on their way to healing based on their choices.
Yeah, and like I believe that, and this is the way that I practice, and this is why I have relationships with, people like you and so many others that we
Yeah,
refer
medical
to
doctors,
in
yeah,
our
yeah,
community is that, in my opinion, it's like exactly what you said. Number one, we should all be able to work together. But also, I also feel like in a lot of ways we should all just stay in our own lane, like
exactly,
like,
yeah,
hey, I have so many people, and I'm sure you realize this because we send, we refer a lot of people over your way, but it's like we have a lot of people that are like-minded, but I'm like, I'm not trying to master every different aspect of health. Okay, I'm
yeah,
trying to master one.
yeah,
Um, which is hard enough in and of itself,
sure,
and then have phenomenal resources that we can give, that we can send people to, whether it is
exactly,
you or whether it is to a pediatrician that we actually do know and trust, we have relationship with, and we know that they're going to, take the most conservative routes, but do what needs to be done when it needs to be done.
exactly, exactly.
Or whether it's the PT next door or, massage therapist or whatever it might be. It's like you got to have that network of people to truly get somebody to a place of overall health and wellness, in my opinion.
No, you're 100% right on all levels. Listen,
Yeah.
as human beings, we're meant to function in a society, to be together. We
Yeah.
depend on each other. There's no such thing as everybody knows it all. And if somebody says that, they're just having an insane amount of pride, and they're
Yeah.
but 100%, you can't help everybody. You have to stay in your lane. Definitely, like I always say, like, mainstream medicine, the general idea of them specializing in things, like even if you take like orthopedic surgery.
Hmm.
You're not never going to find a guy doing wrist, elbow, shoulders, knees, hips, spine. No,
Right.
some guys will go as far as specializing on the wrist or hand or shoulders only, and
Yep.
that's very good because like you said, you're trying to master something there,
Yeah.
and it's not easy in and of itself. So I completely agree with you on that, and that's why like I said, I really like people to start to have a shift in their thinking paradigm,
For sure.
that there's so much available out there. Let go of your notions, preconceived notions, your assumptions, the delusions that you might have. Give things a fair try.
Yeah.
In addition, just because you had a better experience with somebody one time, it's like, okay, you have a bad experience with a waiter at a favorite restaurant. Is that going to
Right.
make you ever going? No.
Right.
I don't care where you go, whether you're accounting, whether it's surgery, whether it's whatever, it might be cleaning service at your house. You will have at some point a bad experience.
Right.
Let it go. But no, that's very important. That's very important. All right, so um, tell us, what exactly is chiropractic, so people have a clear understanding of perhaps what it's not.
Sure. Yeah. This is actually probably one of the things this is one of the most important things that I get across to every single new patient because every patient walks into our office and already has some idea of obviously why they're there, but what they're going to receive and what the whole thing is going to be all about. And for most people, even if they've been to chiropractors, unless they've had a pretty thorough, explanation of what chiropractic is, most people don't really put together, what the whole thing is all about. So
Right.
um,
Yeah.
I will I will tell you this, that chiropractic, I think a lot of people, when they think about chiropractic, they think about, neck pain, back pain. They think about things like the muscles and the bones and the joints. They think about, like you mentioned, the discs of the spine. But the truth of the matter is that that's not really at all what chiropractic is about.
Right.
Chiropractic actually is a science and a profession that's focused on the functionality of the nerves and the nervous system. Okay. So to put it very simply, as the entire human body essentially relies on the central nervous system in order to function properly. Okay, so the central nervous system, for those of you that are watching, is obviously comprised of the brain inside of our skull, and then the spinal cord running down from the brain, and then the nervous system does extend out from that. We call it the peripheral nervous system, and those are the nerves that come out and they go out to the rest of the body. So chiropractic, just in general, is based on the concept that everything in the body, whether it's the muscles of the body, whether it's the organs and systems, so things like the heart, the lungs, the digestive system, the reproductive system, even the immune system, like the body's ability to
Yeah.
launch a successful immune response. All of those things are controlled and coordinated and ultimately modulated through the nervous system. Okay. So when you think about the way that your body functions, when you think about the way that your body heals and works on a day-to-day basis, you really need to be thinking more about the nerves and the nervous system than you are about the rest of the body. Okay.
Yeah.
And so effectively, the way that this works, if we make it really simple, and I brought a little prop that I can bring into the screen for you.
Awesome. A little spine.
Effectively, the way that it works, this is just like a model of the spine. The brain would sit on top. The brain is connected to the spinal cord right at this junction at an area called your brain stem, and then the spinal cord projects down through all the bones, and then the nerves come out from there. Okay, so the brain sits on top. The brain has all the information, kind of like all your God-given potential for your body to function and work the way that it's supposed to. The way that it gets that information out to the body, quite literally, is by sending signals down the spine, and then from there, those signals come out on all the individual nerves and they go out to the body and they tell the body what to do. Okay. So when you're thinking about the way that the body works, basically you can think about like the central nervous system as like your engine, and the rest of it is kind of like all the parts. Or the central nervous system is like the computer or the electrical box, and everything else is like the appliances. Okay. And so, in a perfect world, obviously, what we want to see is 100% of that information coming from the brain, making it down the spinal column and out on all the nerves, and it makes it out to your body at 100%. Okay.
Yeah.
And quite honestly, when it does that, most of the time people function pretty well. Like their bodies function well. As a result of that, you typically feel good. But even
Yeah.
if you are dealing with things like an injury or an illness or a sickness or maybe something chronic that's kind of like creeped up over the years, basically your body is going to rebound quicker. Like it's going to heal up quicker if we
Yeah.
can make sure that that information is flowing at 100%. It's just giving you all of your potential. Okay.
Yeah.
Now, what can interfere with that? And what does commonly interfere with that, just as a result of life? Like we all live in stress. Okay. So, like, we live in gravity, and, we don't always eat the best foods, and we have
Right.
stressful jobs, and, we get into car accidents or sports injuries, maybe when we're kids, things like that. What can happen is that these bones in the spine, the vertebra, can actually begin to like shift and move out of their proper positioning. Okay. When they do that, they actually have the ability then to start exerting pressure and tension onto the nerves and onto the nervous system. And that pressure begins to block that good flow of communication from the brain out to the body. And, to make it easy to understand, it's essentially just putting a dimmer switch on that flow of information from the brain out to the body. And as a result of that, your body does not get all the information it needs from the nervous system, and therefore it starts to move away from 100% functioning and
Yeah.
100% healing. And then over time, as your body's not able to heal, that lack of healing turns into kind of fill in the blank. It affects
Sure.
everybody
Yeah.
differently, but wherever those nerves are going that doesn't get the information, your body won't function the way it should, and it just starts to move away from that 100%. Okay.
Excellent.
Does that make sense on that?
Oh, 100%. Yeah, absolutely.
Okay.
Yeah,
So
absolutely.
our job, basically, as chiropractors, we have one very sole job. Now, if you go into a lot of offices, and nothing wrong with it, it's all within
Sure.
their scope of practice. But you may see a lot of different things. Like you might see nutrition, or you might see footwear, or you might see
Yeah.
exercise routines. Okay, and that's how they choose to practice. I have no problem with that. But there actually is one singular function of the job of the chiropractor, which is to find out if there is any interference on those nerves. And if there is, then the adjustment, which is the procedure that we
Yeah.
typically do, is designed to move those bones back into a more normal position and effectively take that pressure off the nervous system so that the brain and the body can start communicating at 100% again. Okay.
Yeah.
If we can do that and we can do it successfully and we can keep it off for a long enough period of time, then honestly, what happens is the body just goes to work doing what it's designed to do, which is start that process of healing up damaged tissues and healing up damaged organs and things of that nature, and basically start to nudge you back towards 100% or as close as it can possibly get you so
Right.
that your body can start to get better.
Yes.
And then that honestly is typically where the quality of life starts to improve for people, depending on what it is that they have going on. Once that function is improved, the pressure's off, and we give them some time to heal up, then obviously the normal state of the human body is not to be in a chronic state of pain, discomfort, disease, disorder. It's designed to work pretty well on its own. So
Yeah. No, that makes perfect sense.
yeah.
And, like one of the things that I have people ask me, and I have seen too, is which is a visual example, like you talk about organ. People have a severe impingement or something in the cervical spine, and they'll start losing, numbness in the hands, feet, but also even the muscle atrophies.
100%.
It's
Yep.
not like the arm is like almost half the size to a point, or they have no strength.
Yep.
And many times it has been very effectively fixed with chiropractic.
Yeah.
To the
Yeah.
point
I have had several cases like that.
Yeah.
Bodybuilders, you can really see it in like people that really take their training very seriously.
Yeah,
And
lost muscle. Yeah,
yeah, they'll come in and they'll just say, "Hey, like I've been doing the same things that I normally do. I'm not favoring one side or the other." And you can see that I have a 35 or 40% decrease on my left side or on my right side. And that is literally just the muscle is being starved of that nerve information, keeping that muscle alive.
yeah,
It's really a simple concept. And one of the ways that a mentor of mine used to explain it to me is even with like that concept there, it's like you got to realize that healing, like real healing, really comes from the body as long as the
right,
body is functioning properly. It
exactly.
doesn't
Yeah,
come really from anything else. Okay. And a really easy way to understand this is like if a couple weeks ago, I unfortunately almost cut my finger off with a chop saw. Not
well,
a
it's
good
pretty
idea.
good.
Not a good idea if you're a chiropractor. I need my hands. But so I cut my finger, and so when you think about a cut on your skin, okay, that cut, you can do what you need to do to it. You're going to wash it and you're going to take care of it and whatever, okay? But ultimately, what is it that heals that cut? It's that intelligence inside the body
Right,
that knows how to reform these cells and heal this
exactly,
up and give you some scar tissue and give you a scar and then ultimately put it back to where it's supposed to be.
exactly.
And so, you can wrap it with a Band-Aid. I don't go this route, but you can go and get a tetanus shot or do the things that you need to do. But ultimately, it's your body that needs to
Yes.
heal.
Yeah,
And the really easy way to drive that point home to yourself, if you're kind of like, I don't know, this guy might be a little bit quacky, like, I don't know, like the body needs help. Listen, go down to the morgue or go into your freezer and take a piece of beef and cut a split in it. And
see how long it's going to heal.
you can do whatever you want to it, man. You could wrap it in gauze. You can shoot it full of antibiotics. You could stitch it up with
Yeah,
stitches.
he's
And
done.
you'll come back a week later and you'll take all that stuff off and it'll be dead. And why is that? And it's because it's cut off from that life flow that flows inside the body. Same
Absolutely.
way that whenever you have an impingement in your neck, it's cutting off that life flow to that muscle and causing it quite literally, not to be graphic, but basically to die inside
Yeah,
you.
and that's
Now,
what happens.
the the way that I always like to put this together for people is, because a lot of people come into me for that exact reason, whether it's muscle weakness, muscle wasting, or like the numbness and tingling, things like that. It's the things that they can feel. Okay. But what people don't really understand is that the exact same nerves, or not the exact same ones, but the same nerve fibers that control the arm or control the muscles come out and they make your heart beat, they make your lungs breathe, they make your food digest food and
Yeah,
send the food to wherever it needs to go, makes your blood pump, makes your immune system work. So those nerves are responsible for everything. And so a lot of times people will say to me, they'll say, "Hey, doc, like, I think sometimes like you chiropractors think you can cure everything." And the truth of the matter is chiropractic isn't designed to cure anything, not any
right,
one particular thing. All it's designed to do is return that flow of communication, and then that like innate wisdom, that innate, kind of inborn wisdom does what it's supposed to do and heals the body up. And
100%. Yeah,
chiropractors get, they get some props for that. Like they'll say, "Oh, go to the chiropractor for this or that." But the truth of the matter is it's really the body healing. We're just trying to facilitate that.
exactly. Yeah, you're letting the body, aligning the body to the point that it can start to optimally heal itself.
Yeah.
Yeah, no, this is a great example, and this is, I think, one of the biggest misunderstandings. And and another thing too that I'll ask you is, so a lot of people are under the misconception that hey, I'm going to go to the chiropractor a couple of times, and that's all I need. Now, is my personal and professional experience when I've seen with clients, patients, myself, yeah, if you hurt yourself, you have something acute injury that happens, which I have done, training or just sleeping
Sure.
back, whatever it might have been. Um, locked up your neck. Sometimes you wake up and your neck is really locked up.
Yep.
Almost instantaneously, one or two times, most even from the first time, it's like, oh my God, it feels great. Okay, I'm good.
Yep.
That's an acute condition. It obviously helps really good, but for long term health pattern, and especially if you have deeper issues going on, it's essential to be consistent with chiropractic, just like it is essential to eat healthy. To actually, you're not going to go to the gym a couple of days a week for a month and then you'll be good to go.
Right.
You're going to feel better. You're going to even perhaps start seeing results, but you stop. You're cutting yourself short. So it's the consistency. So you have the acute aspect of obviously health, and you also have the ongoing long-term benefit. So you have the short-term benefit and the long-term benefit. And I've experienced both of those. Like when I was in a car accident, I herniated disc, and I kept training, unfortunately, because just I had very high pain tolerance, and I thought I could get away with it. It was stupid. That was a long time ago, over 20 years ago. And I got to the point that I started having really bad disc issues, and I started getting weaknesses, pain. There was a chiropractor that back in Florida that really helped me completely heal from that. It took like 9 weeks, consistency of 2-3 times a week, but massive difference. Literally, I returned back to normal within 4 months completely.
Right.
And the ongoing support, and just the maintenance aspect of it, and also the ongoing, and that made all the difference, and it has. That's why my wife and I are always very big proponents of chiropractic.
Yeah.
Like you said, you fall off every once in a while, you get busy, whatever the case might be, but in general, being consistent makes a difference. I can tell with my wife, especially, she sometimes will get an adjustment and just this release comes over her, like,
Oh yeah.
to the point that she had chiropractors get adjusted her and they'll break out in sweat.
Oh yeah.
It is the most amazing, just this energy release that takes place, whatever you want to explain it. And she just feels like she's walking on cloud nine and just walking on.
Yeah.
Oh yeah. Even though she never had any problems, no pain, no stiffness, tingling,
Yeah.
anything like that. But again, like you're opening those channels for the vital force of the body to heal on many levels.
Yeah.
And back to the thing, I want to emphasize, when people, especially now, there's so much chronic disease, people's organs are diseased. That's what people don't understand. Somebody has diabetes or insulin resistance, you're not going to have a healthy liver. You're not going to have healthy digestion. You're not going to have healthy pancreas, obviously.
Yeah.
And even though you can't see it, and the usual run-of-the-mill standard medical tests, they're worthless. They're not going to really show anything. And they might show elevated blood glucose, perhaps that'll be about it.
Yeah.
Give or take. But again, when you do chiropractic, part of a healthy nutrition lifestyle, that just keeps those channels of healing open. If
Yeah.
if I'm expressing myself correctly here, but that's why it's so important. And again, the ongoing process, and that's why I'll tell people, make those habits, including chiropractic, be normal part of your healthy lifestyle.
Yeah. I mean, it's like anything. Like you're either going to be proactive or you're going to be reactive.
Absolutely. Yeah.
And some people are just wired in a certain way, and that's just, it's unfortunate, like uh, we have return patients all the time, they come in and their body starts to heal. And I honestly, as cold-hearted as this sounds, I almost wish the symptoms wouldn't go away as quick as they do. Like,
Yes.
uh,
Yes, I understand what you're saying.
like I almost wish that the suffering would last a bit longer to give their bodies a little bit more time to heal as we're taking care of them. But
Yeah.
that unfortunately is not the case. And for the most part, especially in the American culture, we have been programmed to believe that a symptom equals sickness and a lack of symptom equals
Equals
health.
health.
Yep.
That's right.
And
Yeah.
that is so far from the truth, as you've seen with your
Oh God,
patients.
yeah. All the time.
Most disease processes, real disease processes, whether it's what you mentioned, like with insulin resistance, or whether it's things like cancers, or whether it's things like whatever, kind of fill in the blank. Most of those processes take decades to truly develop into something that
100%.
causes a symptom.
Yes.
And so you're finding out about the problem kind of at the end of the road. Like it's already turned into such a big issue that it's like a red light flashing at you now, saying, "Hey, there's a problem." Um, and so, we've been trained to think that when we have a symptom, then we're sick, and when we have lack of symptom, then we're healthy. And that couldn't be further from the truth. I mean, so many people are walking around and they don't have symptoms yet of whatever it is, and so they don't get things checked out. And the easiest example for me of this is like, why do you go to your dentist twice a year or four times a year? Why do you do it? My teeth don't hurt. They're in the same place that they were
Yep.
6 months ago. They don't look significantly different color than
If
they
at all.
were.
Yep.
I mean, like, so why do you go? You go to get checked,
Question.
right? You go
Yeah.
to find out, is there a problem going on? And you do it with the assumption that if you continue to do it, that for the most part, you should have decent dental health for your life, as long as you're doing your part at home.
Very true. Yeah.
Yeah. And so with chiropractic, you can kind of think about it in two different like categories, although they are one and the same. But this is the way that the general public thinks about it, is like, basically you have crisis care, which is what you're talking about. You wake
Yeah.
up and you have this thing going on, or you realize that you're having muscle wasting, or you have numbness or tingling, or whatever. You have crisis going on, and so you come in to hopefully get some relief from that crisis care. And it works. I mean, like, chiropractic is one of the most effective ways to get rid of those issues, to be honest. Like,
Yeah. No,
um,
100%.
yeah, I mean, it's incredibly effective. But then there's the aspect of like, do you actually want to stick with it long enough that you give your body a chance to heal? Because the truth of the matter is that most things in your body take somewhere between 6 and 12 months to truly turn over and heal and change. Like,
Very true.
your
Very true.
body, yeah,
Yeah.
your body needs time. It literally needs a proper amount of time and the proper tools. For me, it's chiropractic, and for you, it's like, you can't eat a good diet for 3 weeks and expect to reverse,
Of course
truly
not.
reverse,
Right.
it's like my mom came to you. Remember, my mom came to you.
Oh yeah. She's awesome.
Yeah, 10 years of having to be on anti-inflammatories for some pretty severe gut issues,
Oh yeah.
and daily anti-inflammatories. Well, that process took 12 to 18 months to reverse, but it's because it takes time for your body to actually change and heal. Well, that's no different with your nervous system. And quite honestly, it's usually slower with the nerves than the nervous system. The nervous
Right.
tissue
Yeah.
just
Yeah.
heals very slowly. So there's that crisis care aspect, and chiropractic is great for that. I mean, and I'm never going to turn people away. I'm always going to try and meet them where they're at. But then there's this aspect of the population that really gets it. They're like, this is just part of my body functioning the way that it should.
Yeah.
And I can happily say that we have so many patients that have been with us for 10 plus years on a weekly, bi-weekly, monthly basis. I mean, they're very. I have in our Marietta office. Just yesterday, I saw this sweet couple came in. They were my first patient ever 16 years ago. They came in, they signed up for care, and they've been coming consistently, every week, 3 times a month, twice a month, but very consistently throughout that entire time. And it's just because they get that, like, keeping pressure off the nervous system is just part of a healthy lifestyle.
100%.
Just like going to the gym or eating a balanced, healthy, organic, pure diet is what's going to be best for you in the long term. So
100%. Yeah.
Yeah.
No, you're dead on right on all aspects. And this is one thing that, again, I'm really hoping that things will start, that paradigm shift will take place, because, people on regular basis, literally, and I see it everywhere. They'll drive a car, brand new vehicles, and not just one, just 2 or 3 of them, depending on the family, and they're no less than $400, $500, $600, $700 a month payments each.
At least.
They'll buy new shoes, new clothes, jewelry. There's nothing wrong with that in and of itself, but the reality is that people cannot afford. They'll literally cannot afford to take care of themselves because of that. They don't, get a massage, getting acupuncture, chiropractic care, good quality nutrition,
Yeah.
and they spend the money on the wrong things. Now,
Yeah.
of course, it's great if you can afford all of it, but in all reality, very few people can.
Yeah.
But
Yeah, health has definitely taken a back seat. I don't know if it was ever a huge priority in the American culture, to be honest with you.
Probably not, because all my family, starting from the '60s until the last one when we came in 1990, we're all immigrants.
I also think,
yeah.
I also think that there's a huge misconception of what healthcare is. We call what we do in America healthcare, but the truth of the matter is it's sick care.
Exactly.
What we do is sick care. We respond to sickness, and that's important for people that are sick. But if you're trying to stay healthy, that's not the way to do it. Like, that's not the avenue to do it.
Yeah, there was this thing, back to Australia, the aspect of, immigrants, when people came, most, relatively speaking, especially the early, days of this country, there's not really much chronic disease at all.
Right.
There was emergency stuff, trauma, obviously wars,
Yep.
some kind of acute infections that they might have taken place, but generally speaking, there wasn't. So when people came here, they were healthy, they were ready to go. And, so the focus obviously was stability, making money, acquiring a home, the whole nine. So, because give or take, naturally, they were healthy. I mean, my father and my uncle, they never had any problems up until their, late 60s. And they never really, in no reality, lived a very healthy lifestyle, considering, they smoked a little bit, they drank a little bit.
Yeah.
And there's been a pattern in general throughout, but you're right. The priority here is not. And also the way the things have been conditioned in the American people is that, basically the mentality is there's a pill for every ill.
Yeah.
You feel a certain way, take a pill. If something happens, you go to a doctor. And one of the things that I work with a lot of my patients is, trying to educate them. If you sneeze the wrong way, stop running to your doctor and getting a Z-Pack.
Yeah.
I mean, it's the slightest little thing. They get blasted. So you just literally undid the last 2 months that we just did.
Yeah. And, what they would realize, I think, if we got away from this quick fix, fast paced, fast service type of society,
Yes.
Is that if you just let your body go through it, then eventually you really truly build up. I mean, you build up true, like, immunity to most things that are floating around you, man. Like, I interact every day with somewhere between 5 days a week, with somewhere between 70 and 90 patients every day, right?
Yeah.
I mean, a huge percentage of them are coughing, sneezing, they have the flu, they have COVID, we never shut down during COVID. We saw, like, eventually your body, like training your muscles, eventually your body gets strong and can actually live a pretty decent life without having to be sick, expressing symptoms, every 8 weeks, you're down with something else, you're down with this, or you're down with that.
Which you see all the time. Yeah.
Yeah.
And also in your case, correct me if I'm wrong, but it's not like you're standing anywhere from 6 feet away from people when you're doing an exam. You're in their faces. I mean,
we're in it, man. Yeah.
You're like 2 or 3 inches away from somebody's mouth.
Yeah. I mean,
when you
yeah.
get it. And not only
Adjustments
that,
are
you never wear
adjustments are in a
masks.
very small space. Yeah.
Exactly.
So, yeah.
Yes, back to your point, exactly right, because this is how you build natural immunity,
Yeah.
and it takes place. Yeah, and I completely agree. And like I said, I really hope that things start to shift because we need that. I mean, this. We're approaching 70, perhaps 70+% of the U.S. population has at least one chronic disease.
Yeah.
I mean, what was it? This was last year's statistic for autism was 1 in 30, as opposed to I think 30, 40 years ago it was like 1 in 10,000.
1 in 10,000. Yeah.
It is ridiculous.
It's very
You know,
sad. Yeah.
So, statins are not fixing heart disease. Blood pressure medication is not fixing heart disease. GERD medications and PPI inhibitors are not fixing GI issues.
No.
Yet yet these are number one prescribed medications nonstop.
Yep.
So no, this is I'm really excited we talked because chiropractic should be a very important part of a healthy lifestyle.
Yeah.
And like you said, it's much easier to prevent. You can be proactive. It's so much easier and cheaper than being reactive.
Yeah, 100%.
On all levels. Last, before we go,
yeah,
do you want to maybe share some really cool testimony, something really that just really stands out if you want to?
Yeah, I mean we have tons of them. I mean you obviously I'm sure you can imagine the ones that are hey my neck pain is gone or my this is gone or whatever, my low back pain is gone. But and I shouldn't even poo-poo those things, because the truth of the matter is that whenever your body is functioning and feeling the way that it should, it means that you can play with your kids. So the testimonial isn't my sciatica went away. It's that I can play soccer with my son. That's the testimonial, okay? Or that I'm not miserable to my spouse because and we have people that report this. Hey, since he's being adjusted or since she's being adjusted, our home life is better. Because when you're in a state of chronic pain, discomfort, or dysfunction, you just can't be at peace. You can't be at peace with anybody. And so
100%.
Yeah, and so those are awesome. I mean, the big things, in kids that we see and we hear all the time is hey, my kids avoided ear tubes. My kids no longer needed that. He was scheduled for a tonsillectomy. We gave this a couple of months instead of doing that right off the rip, and he hasn't been sick. I had a lady. They just finished up their first year of care with me. They were seeing somebody else in Atlanta for a couple of months, and then they moved up this way. But this is the first year, the first full 12 months, and now it's been 14 months that their son wasn't in the hospital for reoccurring chest infections, nasal infections, those sorts of things. And it wasn't usually once a year. It was once a month they were in the ER with these issues, right? And so those are awesome to see because I love seeing kids grow up healthy. I love seeing kids being healthy and thriving, and that's honestly what got me into it. Recently I had an older gentleman, not too much older. He's in his late 60s, early 70s, but unfortunately, this guy is not doing a lot other than chiropractic to change his lifestyle. However, he did get under care, and he's been under care now for about a year, and he went back for his yearly heart scan, and the doctor told him that his heart was actually healing. Okay, his heart was actually getting stronger. His heart was actually getting stronger, which just goes back to what we were talking about with, hey, you clear those pathways, and the body has this innate, God-given, desire to heal up and get stronger over time. Other really cool things that we've seen is hey, it's almost like a running joke. It's hey, you got my wife pregnant, which of course is not what that means, but it means, hey, we were unable to conceive, we were unable to have kids. And we came in, we got under good, consistent care. And what happens is the hormonal system starts to balance itself out, whether that be in the male or the female. And then that creates a more hospital environment for conception to happen. And now, they're pregnant and they have a kid on the way. So just, awesome things like that. Awesome. I mean, and probably a million things, obviously a million things I can't I can't even think of or mention. But those are some things. I'll share one more with you that I think stuck out to me. It happened probably about midway through my career, so maybe 7 or 8 years ago. And it was actually a family friend of mine, and she started having seizures as an adult, which is strange. Like she just
That
started.
is strange. Yeah, that's unusual. Yeah.
Yeah. So she started having these seizures. And so and I'm sure you deal with people with seizures in your practice, and it really stunts their ability to have a normal life because they are all of a sudden become, and she was a single woman. And so, she became basically like homebound because she can't drive. Because of the seizures, she can't go to work because of the seizures, like all this type of stuff. And so, kind of like as a last ditch resort, she reached out to me and she said, "Hey, have you ever taken care of anybody with this issue?" And I said, "Of course, yeah, we've taken care of lots of people with seizures." And so, seizures are essentially a disorder of the nervous system. And so, she got her son to drive down from Ball Ground, Georgia to Marietta, and they would come down 3 times a week. And within 6 months or so, the issue had resolved to the point where she was able to get her driver's license back. She was able to start getting her
Wow.
life back.
Yeah.
And the really cool thing was not really cool. It's very sad, but I'm very glad that it took the path it did and not the path it could have.
Yes.
Is she sent me a letter and just said, "Hey, just want you to know that 6 months ago or 12 months ago, I can't remember how long she was under care, but whenever I started with you, if this didn't work, my next resort was I was just going to end my life because I can't live a life where I feel trapped and I feel useless and I feel depressed all the time."
Yeah.
And so, it's amazing when the body functions, just how much life can like be restored, like
Oh
to
no,
the point
absolutely.
where you
Yeah.
actually want to live again,
Yeah. Oh no, no, that's a powerful testimony, man, and that is absolutely true.
Yeah.
On a more of I've seen a pattern. I'm going to kind of piggyback on the one you talked about how people get pregnant. So yeah, it's not a subject that people are going to talk about a lot.
Yeah.
But when you have back pain, hip issues, sciatica, it's debilitating. So
Yeah.
first of all, is the relational aspect of you're miserable.
Yeah.
You can't play with your kids. Your spouse wants to go walk in the, go shopping or something. You can't. You don't feel good. You're hanging. Well, also a lot of people that talk about it's male or female, either one. When they have those problems, well, guess what? Sexual intercourse is not going to be really a.
Yeah.
Well,
Yeah.
I mean,
Not fun.
of course, that can
Yeah.
end the marriage itself.
Yeah. Yeah.
So when you're talking about psychological well-being and relational well-being, it's all part of it, and that literally can make a massive difference. And back to the pregnancy, not just the hormonal aspect, but yeah, I mean, if you're not having healthy marital intimacy, how are you going to get pregnant?
Yeah.
But these are taboo subjects that people don't really want to discuss, and they get
Right.
embarrassed about. But no, and I've seen that. It's amazing.
Yeah. Yeah. It is. It's incredible. It's incredible.
Man, that is so cool. Well, guys, we are out of time. However, I want to ask you, Dr. Dan, tell me where your practice is. Tell me how people can reach you.
Sure.
Website.
So we have 2 offices. My wife also is a chiropractor, but since we've had kids, she has taken a step away from clinical responsibility. So,
Yeah.
so both of our offices, I do all of the clinical aspect in. One of them is in Marietta. That's the one that you guys used to come
Yeah.
to. If you're in that area, it's right across the street from Sprayberry High School. Easiest way to get us is either on our website, which is the name of our clinic, which is friendsandfamilychiropractic.com. You can book a free consultation on there, schedule an appointment, whatever. We also have the ability to text and chat with you through there. Also, if you just want to call and talk to me, we do phone consultations. Our number over there is 770-485-0322. And then our office in Alpharetta, that's our second location. That was initially my wife's office. we're right on Main Street in Alpharetta. That's actually where I'm at right now. We're on Main Street in Alpharetta. That one is not called Friends and Family. It's called Capstone Chiropractic. CAPSTONE Chiropractic. Same thing with the web address. It's capstonechiropractic.com. Our phone number here is 770-864-1195. Again, I do complimentary consultations if you're dealing with anything that we just talked about, or many other things. I mean, it's impossible to touch on everything, but if you're just not where you want to be, a good start is just to talk.
And that's the thing. It doesn't cost anything. You don't have to deal with insurance, approvals, any of that nonsense.
Just come talk.
Talk to you, get a free consultation, get an evaluation, and
Yep.
you can ultimately be able to say, yes, I can help you, or no, I can't help you. Let me refer you out, or here's what I suggest.
Exactly. Yep.
Yeah. Oh, that's amazing. Well, Dr. Dan, thank you so much. We could be sitting here talking for a long time.
Yep.
By the way, you and I discussed doing some really good health fairs.
Yeah.
Guys, stay tuned for that because we're very excited. We're going to do some, truly holistic health fair aspect of bringing different professions in, different talks that we're going to talk about. So, a lot of people, like to, meet people in person, ask questions. I think that'll be a great opportunity for you all to come and meet everybody, talk to, ask your questions, let us know your concerns, and see if we can help you or perhaps clarify things for you. But I'm really excited for us. That's stay tuned. That'll be to come, and we're gonna definitely do one in Alpharetta and in Marietta, both places. So that'll be super exciting. Well, this is it for today's episode, and at your Health Reclaim with Dr. PND. Dr. Dan, thank you so much again, and
thank you for having me.
Day, brother. I'll talk to you and see you soon.
Yep, appreciate you. Thank you.
Bye.
Bye.
Thank you for your valuable time and for listening to the Your Health Reclaim podcast with Dr. PND. Be sure to hit the subscribe button and share this episode with a person you know it can help. If we can help you in any way, or you would like to connect with Dr. PND, please visit drpnd.com. That's drpnd.com.